Well, good evening, everyone. This is Dr. Ellithorpe with Tustin Longevity Center. We do this um, Ask the Doctor Anything every Tuesday night at 6 o'clock Pacific Standard Time to 7 o'clock. And so the questions that you might have, you can type in either on the live YouTube chat area if you're on YouTube and subscribed. The other thing we do is we do take email questions. I'm going to try and catch up with some of my email questions. Last time I did so many of the live questions, I didn't get a chance to do any of the email questions, and we have 3 pages worth. So I'll try my best to do that. I do like talking to the people who are actually present and on live questioning. So we'll go from there. These are not meant to be treatment or management over the internet or YouTube. This is for educational purposes only. So if you have concerns about your health or unsure what to do, please call your physician, go to the urgent care or the ER. If you are one of my patients, please call the office and let us know what your needs are. If it's an urgent thing, of course, you're going to have to use the urgent care system. But in general, most of the things we try and do are preventive and functional medicine. And so this is designed to try and tell you how to stay well. Okay, so we have a couple of live questions. Mari says, what prenatal supplement do you recommend? I recommend my multivitamin called Energy Core or MitoCore, mitochondrial energy. It's a multivitamin, mineral, B vitamin with wonderful oils and stuff in it. So I've used that for many, many decades, and we've had just the best babies. Plus, I ask all my pregnant women to be on Juice Plus, vitamin D, and iodine. Those are my bare minimum. The TLC Energy Core, or the other name for it is MitoCore, Juice Plus, vitamin D, and iodine. That's the what we use. Next question from Tiziana. Hi, Tiziana. Hi, Dr. Rita. Is there a comparable product to the metabolic formula and the systemic enzymes, perhaps from Ortho or similar brand? Asking for a friend. Let's see. Is there one from Orthomolecular comparable to TLC metabolic formula? I don't know if there is. I do know that Orthomolecular has the Vascuzyme, and so that would be a systemic enzyme. But as far as a comparable TLC metabolic, this will have berberine in it. It'll have alpha lipoic acid, things like chromium or vanadium to help with sugar metabolism and liver function, metabolic syndrome. So that's my answer to that. Yeah. Okay, now to last week's questions. Aniki says, my friend's 35-year-old son has ulcerative colitis. He is very strict with his diet, mostly low-fat proteins. I would not try and be low-fat. I would try and use plenty of healthy fat proteins like chicken, some beef. I would use all the beef and fatty beef that you would like. He limits his diet to the 10 items that don't cause bleeding. Well, that means the lining of the gut has tremendous leakiness and irritable bowel, inflammatory bowel behavior. And the membrane, the one cell membrane, is made up of protein and fat. So that's what you want to eat so you can replace that. Not fruits or vegetables don't have this comparable phospholipid and protein source rich enough to help you heal things. So I would find out his blood type, A, B, O, AB type blood. If he's an A type blood, he should be on digestive enzymes whenever he eats food, and just titrate to what feels good as far as diminished gas, good momentum, flow through dynamic of moving his bowels. I would give him phospholipids as a powder mixed in like a half cup of warm water, like you're making a baby bottle. I would mix in with that SBI Protect, which is serum bovine immunoglobulin, IgA. That's the number one immunoglobulin that helps protect the from your saliva all the way down to your gut. I would be on vitamin D. I would be on a multi-mineral rich in zinc, and the zinc and selenium that will help the immune system. And I would take a methyl, excuse me, I still have a bit of the cough and I work all day and talk all day, but I would take the methyl B complex. All right, now, and then I would find a good functional doctor who could do some complete digestive stool analysis, IgG, food allergy testing, do some, unique hormone, cortisol, male hormone, precursor DHEAs, get his insulin, his inflammatory markers, and just put together what he's reacting to in the food, the complete stool analysis, probiotics that he may or may not need, blood type, digestive enzyme, get him on the phospholipid mixed with the SBI Protect powder in warm water, morning and evening, to kind of coat the gut lining. Find a good functional doctor who knows how to do these readings and understandings and walk him through this, and he should be able to heal. I think the vitamin D and the methyl B complex and the multi-mineral with zinc to all help his immune system are very important. The next question is from Donna. Our dentist has recommended that we brush our teeth with a toothpaste that contains moderate levels of fluoride. No, we are in a late 60s. We are in a late 60s. Oh, that must be her age. Okay. Stick to a keto diet. So it looks like she's trying to watch her carbs, drink plenty of water, and eat on an intermittent fasting diet. Okay. What are your thoughts about toothpaste with fluoride versus those that contain no fluoride, such as nanohydroxyapatite? I am against fluoride. I've been against it for 40 plus years. I've been practicing about 44. And this is a waste material, I think, of aluminum processing. And this is a material that is just generating in the water fluorosilicic acid. Fluoride is a terrible halide, and it has no place, in my opinion, nor in any research I've seen, nor in practical dentistries. Because if you look at European dentists, they have non-fluoridated children, and their teeth don't have any higher breakdown of cavity compared to the American, who is fluoridated, and it's associated with IQ problems and many other issues. No, I'm against fluoride. Nori says on the next question, is refined coconut oil a good alternative for cooking to avoid the strong flavor? Also, are some palm oils bad for you? Your thoughts on Epsom salts baths as well. Okay, well, I don't like coconut oil. It's if that's all I had, I would use it. And the reason is I use butter or ghee. I use bacon drippings. I use beef tallow, suet, these natural saturated fats. That's what I use. So that there are no double bonds that can be heated and turned into trans fatty acids. Anytime you start getting into plants, even though palm oil has minimal double bonds, it's largely a medium chain triglyceride oil. I just don't want to work with it when I have butter and when I have beef fat and bacon fat and suet oils from pigs, so or the bacon grease. So, for heaven's sakes, I'm not anti palm oil, let's say coconut oil, but palm oils, any other plant oil, the only one I would even conceivably use is coconut oil. And that I probably would only use in an extreme situation when I didn't have other things. I don't like the risks of these double bonds and having them fractured, hydrogenated, and turned into trans bonds. Sally says, I would appreciate your thoughts on how to treat chronic itchy hives. I've had them for 7 weeks. One Allegra works for a couple of days, but then they return. I follow the recommended lifestyle habits of a low carb, water, no food for 2 hours before bed, take Vascuzyme, methyl B complex, multimin, K4s, Vitality C, that's a vitamin C powder, and quercetin, and no dairy. Thank you. Well, Sally, I'm not sure if I know who you are, but what I would say is chronic hives needs to be followed and worked up. Something is irritating you and your immune system to give you this reaction. Is it a new food? Is it an environmental seasonal pollen? Is it mold in your house? Is it a alcoholic beverage? Sometimes the sulfates in wine do this to people, even with very minimal usage. Is it just anxiety? Even just emotions can do this. You should have a workup to include looking at your stool, looking at your foods, getting your skin prick, for hives and scratch tests or something like that. And you should, not stop the Allegra, fexobenadine or something like that. That's a antihistamine, Allegra, long acting. There is loratadine from Claritin. That is another excellent source. So if you're building tolerance with Allegra, maybe the loratadine from Claritin would be a good alternate choice. Now, I am turning sour on Zyrtec, which is citrulline, which is another antihistamine. These are all antihistamines, but only the loratadine from Claritin and the Allegra fexofenadine, something like that, is what I would alternate between the two. How much quercetin are you taking? I would use somewhere in the realm of 800 milligrams a day of that, which if you're using D-Hist by Orthomolecular or our seasonal shield, which is our private label D-Hist, I would take 2 in the morning, 2 in the evening. I would eat a carnivore diet, and I would do that for at least maybe a month, 100%, and see if that kind of just stops this from happening. You might see your doctor, see a allergist to do skin testing, get some clear your diet down to a carnivore diet and water, just so your whole immune system calms down. That's probably the direction I would go. Let's see, we have another question, and that is, great is thy faithfulness. Yes, my daughter has a prescription for ciprofloxacin. That's a fluoride-based antibiotic, eardrops, due to small ear canals with tubes and occasional ear infections. She is 22 years old with Down syndrome. Are these drops as bad as oral? No, they're not. The topical forms are safer. So I would feel much more comfortable using these topical as opposed to oral fluoride-based ciprofloxacin, levofloxacin. Beth says, how would you go about healing interstitial cystitis in a 33-year-old mom that has had 3 children, not overweight, and is fit and active? Well, you need a workup by a functional doctor who will look for autoimmune inflammatory changes in your metabolic workup. That might also include a complete digestive stool analysis, hormone replacement support. If you'd been on the birth control pill a long, long time, that can diminish the quality of the cell membranes in the urogenital area. Look at your insulin and your fasting blood sugar ranges with triglyceride and your hemoglobin A1C. Anything that makes the cell membranes lining the bladder and urogenital tract, they're made of the same phospholipids and proteins and healthy fats. So we as a society have been eating all this harmful food lectin containing glyphosated, genetically modified, oxalate rich plantain foods, sugar, 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 and this can harm the cell membranes. What we need is a healthy meat, fish, chicken, pork, egg, shrimp, lobster, fish diet, and lots of butter. And that tends to provide all these molecules of phospholipids and proteins and healthy fats to repair the cell membranes, because that is what is getting too easily triggered by some antagonistic molecule, be it a chemical maybe you're ingesting in your food, or you're absorbing through your clothes through the rayon plasticized kind of clothing that we have, all the plastics. It could be the candles and the paraffins that are being put into the air and you're breathing it in. There's all kinds of things. So get a good functional doctor and then start your workup from looking at your hormones, your stress hormones, your sugar metabolism, your digestive abilities, your blood type, stress hormones, urine samples, all that, and then work with a functional doctor alongside of your urologist and see if they can't together work and find a solution for you. Let's see. Then Beth says, how would you go about healing? Oh, we did the interstitial cystitis. Tiziana said, why are you turning sour on Zyrtec? Just curious. Well, I do study all the time. And one of the doctors that are young on YouTube is named Casey, Casey Peevler, P as in Peter, Eavler, MD. And he has a channel called Mitochondriacs, meaning your mitochondria are the engines of your cells. And they're full of those wonderful phospholipid membranes and all those fantastic antioxidants that help you make ATP, the Krebs cycle production for ATP. And there is the argument that cancer is a chronic metabolic mitochondrial disease, damage to your engines. Now, this Dr. Casey Peevler has looked at antihistamines, and Claritin, loratadine, has some anti-cancer benefits, whereas Zyrtec, which is citrazine, has actually had some pro-cancer research conundrums there. So I personally, when I read that, because I use citrazine for my chronic allergies, I stopped it, and I am sticking with the research that is piling up for anti-cancer mitochondrial preservation, and that is Claritin, loratadine. And I'll have to, you can email Dr. Casey Peevler and say, what does he think of Allegra phenoxybenzidine or something like that. Okay, Fenox. Well, anyway, look up the generic form of Allegra. That's what the reason there, Tiziana. Amela, hi, Dr. Rita. My mom's urine test showed calcium oxalate crystals. That's very common, Amela. It's not unusual. She is 73 years old and had a overactive bladder. How should she improve her condition naturally? She has to go into the computer and look up oxalate foods, oxalate-rich foods. And that's all the dark leafy greens, the spinach, the kale. You got to get that out of your diet. But there's many other things that are rich in oxalates. And just avoid those and really drink a lot of water. That's the direction I would head, but that's not unusual. I had that myself as an ER doctor and as a young doctor for many years. I just didn't take care of myself, and I was running from bay to bay to crisis and crash, patients and accidents and gunshot wounds. And I just never drank enough water, and then I wound up getting kidney stones. And I had calcium oxalate also, and I didn't know about leafy greens, and I loved spinach, and I would eat spinach very, very often. So I stopped that, and I had one other kidney stone, which was, again, horrible. Again, not taking care of myself, not drinking enough water. And I will never do that again. I will drink my water no matter what now. I'll stop anything. I'll say, I have to take time to go pee. Excuse me. So let's go back to some of these questions here. Jill says, my husband will be 40 years old this year. He has a problem urinating, slow to start. Could this be prostate? Yes. It's going to take a couple of months to get into his doctor, so I hope at least getting supplement recommendations. He eats well and exercises daily. He is in fire services, so exposure is bad and sleep cycle is impossible, unfortunately. Thank you for your help. Well, I would say, I wonder what you think is eating well, because the standard American and the government-supported industrial diet food pyramid is destructive for the military. They support the planning of the diet in the military, in the hospitals, in the prisons, in all our schools. All of these sources are influenced by our corrupt, too big government, and it is creating this chronic metabolic problem. And high carbohydrates generate a degree of fermentation in your gut, and that fermentation of the grains and carbohydrates generates alcohol, and alcohol will promote testosterone conversion into estradiol, and estradiol makes the glandular tissue of the prostate swell. Alcohol drinking would be horrible. So sugar drinks, standard American carbohydrate-rich diet, lots of grains, all these things. So if you Google estradiol and benign prostatic hypertrophy, you'll see tons. I used to write about this back in the 90s. I was going to write a book. I started writing about testosterone and how it's failing. And then we had to move. And so I left the book with the other doctor I left with. They tried to sell me back the transcript of it. I just didn't have the money or the time to continue writing the book. But I would have had that written long before all this testosterone craze of the last 35 years. But anyway, it is alcohol and grains, high carb diet that creates fermentation in the gut, that creates alcohol. Your liver only has so much alcohol dehydrogenase enzymes to break down alcohol. And you can drink alcohol and exceed that, or you can eat enough grains and carbohydrate sugars that it will ferment, and that exceeds your liver's capacity to detoxify the alcohol, which then will rise in your body. You'll develop craving and addiction for this pattern. And that estrogen promotion, the shift of the metabolism of the testosterone into estradiol from testosterone, will make the prostate gland swell. So I would look at that. Pumpkin seeds. If you got, salted pumpkin seeds, not roasted or raw pumpkin seeds, and you had like 40 of them, chew 10 4 times a day. Pumpkin seeds have, various natural items in them that helps to work naturally to shrink the prostate. Beta sitosterol, that's in like salt palmetto. I think that's also in pumpkin seeds. These are things that help as well. All right. Any other question? Great is thy faithfulness says, do you recommend getting organic acid tests? You could do everything on the planet. Great is thy faithfulness. Great Plains, Great Plains Labs. What is that guy's name? He does the organic acid profile. He's been doing that for 30, 40 years. And these organic acids, if you're trained, but most doctors have a lousy chemistry foundation, and they wouldn't understand organic acid metabolism in the body. So Great Plains organic acid testing, I think it's in Kansas. Just can't think of that professor's name who has done it. But you have to draw a limit to it. Is it some miracle little biochemical test, great is thy faithfulness, that we need to find some miracle molecule, or is it humbling our diet down to a narrower window of eating, 4 to 6 hours earlier in the day, not eating late at night, trying to end your eating by 4 or 5, the latest, drinking enough water, exercising, getting rich proteins in your diet, very minimal grains and dairy, or eliminate them, and have that with certain systemic enzymes, digestive enzymes, find out your blood type. Usually we are fearfully and wonderfully made, and our Creator has the way to figure all this out and repair ourselves. So do we need organic testing? I have gotten through 44 years without using Great Plains organic acid testing. There's probably some areas that it could have helped me, but I can't. My patients, the whole idea here is to try and help you people be protected from the corrupt, over bloated, huge centralized government control of everything we do, from our eating to what we drink and these things. And I'm trying to get you to get personal responsibility for your own life and health. And most of you don't have the money or the time to do all this specialty testing. So I'm trying to take insurance and make it on what insurance will pay. And those criminal organizations are tying us off and paying us less and less. It's a criminal syndicate. It's like a third-party pimp. We need to get back to fee for service. You have to remember, when I was a young doctor, I had a mentor at Chicago Medical School, family practice. This guy had his office, I guess it was in part of his home. Anyway, I think a follow-up visit was $2.50 and a new patient was $7. Give me a break, everyone. We're being slowly cooked like frogs. We're being duped by lying criminal members of Congress, lying senators, lying congressmen, who, I don't care what their party is, R or D, I don't care. They are not godly constitutional. I don't care about actual Doge, Department of government efficiency. Follow the damn Constitution. There is no reason to have a Department of Education. There is no reason to have a Human Health Services. There's no reason to have ATF, and on it goes. Our government has turned into a criminal, hidden, thievery, hypocritical, godless, and I would even say demonic, child hurting organization. And we've allowed this, so we have to get back to it. So all this to say, do we need organic acids? Look at if you have good doctors who are trained, they're going to be able to do most everything. And we should have some specialists for those rare special times where your general doctor can't get it all figured out. All right. Joanne says, how do you test for mold toxicity, and what would be treatment to rid oneself of mold toxicity? Thank you, and God bless you. Well, mold is everywhere. So there isn't, you talk about the PCR testing for COVID and antigen, they can find one molecule and raise the cycle for testing it up to 40, and they can make everyone positive for COVID. They are evil, evil people. But there's mold everywhere. There's mold on me right now. There's mold on you. There's mold everywhere. Maybe if you're in the sub-Saharan desert or in Death Valley where it's so dry, it wouldn't be there. But you're going to find some molecules of it everywhere. But the thing is, if you're healthy, if you have a good barrier, a good immune system, if your house has not had water damage, if you have all kinds of wet plants and wet pots, if you have lots of foliage around your house and it's sprinkled all the time and there's this chronic moisture, well, that'll make mold happen. Now, how do you test for it? Well, normally there are certain tests for Bacchi strat. I forget the name of the black mold name. Aspergillus, various others. You can do these screening tests. The doctor would type in mold screening, and there'll be the standard ones there. You can look for antibodies to it. You could hire a mold testing environmental company to come to look to your house where you might suspect water damage. So these are the ways you can treat it. So I usually tell my patients who bring it up that I don't specialize in this. Yes, we can do some testing. There are doctors who put themselves out there as specialists in detoxing from mold. But I just tell my patients, we need to build up your defense. I mean, if you don't know how to shut your windows at night and lock them in your doors, then bad things can crawl into your house, and thieves and robbers and killers. So I am telling you how to repair your cell membrane, phospholipid membranes with a healthy protein, healthy fat diet, low in carbs. And in the meantime, maybe your curtains, maybe your rugs, maybe your plants, maybe look for water damage, maybe the plants are too close to your house. These are things you can clear up on your own as we do this other workup. Otherwise, you can find people who put themselves out there. Let's see, who is this one person that I just did a continuing medical education on her, Dr. Jill Krista, Crista, naturopathic doctor, and it's called Break the Mold, 5 Tools to Conquer Mold and Take Back Your Health. So her name is Dr. Jill Krista. But I do almost all of the stuff she's talking about in there. But there are people out there, even in the functional world, who only want to look at one narrow area. And God bless them. I guess we need them. I've never had anyone that we couldn't get out, solve the other way. Let's see. Next one is Sarah says, "Hi, Dr. E. Hugs back to you also, Sarah. How or what are your thoughts on a baby with sleep apnea? The ENT doctor says reduction is needed. I've spoken with, but not regularly, seeing a natural pediatrician. He said maybe allergies." Well, find out your blood type, find out your baby's blood type. Um, how old is the infant? Is the baby just being breastfed? It's good to try and breastfeed your baby for as long as the baby can be satiated with a breastfed diet. If you can get a full year, that'd be fantastic. Um, and basically breastfeeding is like a carnivore diet. So is the baby, did the mother make the baby overweight? We have an epidemic of uh, fat babies, obese newborn babies, and that will make more tissue edematous and trouble with sleeping. Um, the other thing is, you know, I am not a specialist as a pediatrician, nor with newborns, but in general, the foods that are out there by Gerber and the formulas are all full of plant lectins, pea-based protein, uh, and contaminants and sugars that are just inflaming. And that will increase the mucus production and the tissue swelling along the GI tract there, which is right next to your trachea and stuff. So those are some of my off the cuff thoughts on that. Um, let's see. ILIE. I don't know how to say your name. How would you raise testosterone? I weigh 376 pounds. My levels are under the minimum range. Would I take fertility treatments? Do you have videos about raising testosterone? What I would recommend is weightlifting. I would do weightlifting 3 times a week for at least a half an hour, upper and lower bodies. You could start on the machines that have the pins in them. Weightlifting always brings up testosterone. Now, there is a biannual curve to male production. So it's lowest in January, February, March, April, and it starts to climb in May, June, July, August, September, October-ish, November. So there's a biannual cycle for men, but there's a monthly cycle for women. The lowest time for a man is in late December, January, February, March, April. So you could probably be just looking at your lowest range. I would also go on a rich protein carnivore mostly diet. I would eat protein for breakfast, snack, lunch, snack, or early dinner, never eating, say, past 5 p.m. I would do the weightlifting. I would drink, half your weight in pounds is water. So if you're 376, you need 150 plus ounces. So you need about a gallon and a quarter or a third of water every day. So that'll do it. And yeah, that's what my suggestion is. Then he goes on to ask, Dr. Rita, I love you and God bless you. I thought of fasting to improve my testosterone levels. Yeah, just do the weight training, the more carnivore diet, don't eat late, drink plenty of water, and you'll see it go up. And then just understand you're just sampling probably your testosterone at the lowest time for all men, all male animals. Sarah says reduction of adenoids and tonsils. Yeah, so I'm not going to say, that I recommend that, and I don't know the situation or the child scenario. Breastfed till 1.5 years old, wonderful. Whole food diet. All right. And Il says, I have a hernia. Well, work on the machines with the pins and go to the drugstore and get a Velcro wrap around your waist, abdomen, and just work within the ranges you can without straining yourself with any silly, heavy weights, and just do more slow repetitions rather than a fast, heavy lift of a very high weight. The machines with the pins would be the direction I would go. Um, Let's see. I think I missed one. Nori says, "Hi, I know after years of clinical experience, you highly recommend Argentine silver, nothing homemade. But can you tell me if there is any scientific research to show how the metal is released from the body so that it does not build up to toxic levels? I hear conflicting advice. Thank you." Well, I've been around the research on Argentine silver for decades, and the amount of Argentine silver is 23 parts per billion. Okay, that's very low, but it's nanoparticular, meaning it's uniform, so tiny, it's uniform in that water. Whereas colloidal silver can have up to 3,000, 3,500 parts per billion. It's massively more. Never ever have I ever seen any research with Argentine silver that it builds up in the body. Never. So just leave it at that. I've done the research, it's out there. You can contact Argentine Silver, the company, and you can ask them for a copy of their research. I did this, I don't know, decades ago. So I don't know where it's at anymore. But the data is sound on the independent research on nanoparticulate, low count. Remember, it's 23 parts per billion. So it's incredibly safe. All right, now the next item is, that was Nori. All right, Linda says, any recommendations for preventing shingles? That's a varicella, um, chickenpox viral that lives in your spine after you get chickenpox. And then later in life, when you're under stress and your immune system is dropping, usually in older people, it'll crawl out on one of the nerve dermatomes, and you'd get it along one nerve lining on the right side or the left side. All right, so is there any recommendation for preventing it? Take care of your immune system. Eat a low carb diet. Exercise. Get a good night's sleep. Drink enough water. Take enough vitamin D. Have the level checked so that you're in that 80 to 120 range. Make sure your insulin is 3 or 4. Make sure your triglycerides are equal to your HDL from your lipid profile, high density lipoproteins, that they're equal from exercise compared to the carbs you're eating. So I like triglycerides usually around 50, HDL around 50. Take a good systemic enzyme, take a good vitamins, mineral with selenium and zinc in it for your immune system. Take a methylated B complex, it's water soluble. Your B vitamins go away with age, and you pee them out so easily, and you use them up so much more. The older you get, the more stressed you are. Have a lot of vitamin C around. See, I'm still recovering from my cold, and I have my vitamin C capsules, and I will just open this little capsule up. It's empty now. It's tart. But I always have these sitting on my desk here because being in my 70s and working all the time, I have people coughing on me. I have my grandkids coughing on me, little toddler babies and preschoolers. And so vitamin C will help you. And then if you unfortunately get a breakout, come in and get a high dose vitamin C drip and do it day after day after day for the first few days. see your doctor. You could take an antiviral like valcyclovir, so you have less cell membrane breakdown on that nerve that will create postherpetic neuropathy pain. So that's what I would do. Then Lisa says, I have a Berkey water filter, which I fill a carafe with daily. And I place my beamer pad around at a setting of 10 for 8 minutes. So a beamer pad is emitting a frequency into the water. That means the water molecules are going to kind of harmonize with an energy pulse. And you've also recommended Izumio water, Analemma wand, and the Mayu swirl. Please share the difference of these products, what you recommend to accompany the Berkey filter for best health, and where you get your wand. I get my wand. This is my wand right here, and I have it in my water jug, and I drink out of this glass with the wand in it. See, this wand is right here, okay? This is a crystal that is full of structured water. It's thicker than regular water. It takes a long time for that bubble to move. If that was water, general water of a carpenter level, it would immediately flip around. I get this wand at Analemma, ANALEMMA-water.com. And it costs about $170, and I can unscrew it and then screw it back on this way, so it's like a pen, and I can take it with me so it won't break. Remember, this is crystal, and crystal is a transmitter of frequency. This is silicone glass, and that's an insulator of frequency energy. So this is crystal, this is silicone. So when I put this in the water, into the water, through the crystal right here, this structured water, it takes about a year to make one of these, to make enough structured water, exclusion zone water. When I put that in, it's going to entrain the water molecules to listen to the frequency which is dominant of what's contained in that wand. So when that water comes into my body, it's better absorbed, and my membranes will respond better for energy demands. When I go outside in the infrared sun, kick off my shoes and have my feet grounded, I'll get more energy passing up from the earth and to me from infrared light waves in 2 minutes every morning, and that'll give me energy. So that's what the Analemma water is. It is the best. That's the peak thing I would do. Now, I have here my Mayu water. See, and it's swirling. See that swirl going on? But as soon as I take it off the magnetic and the swirl diminishes, then the organization of the structure of the water fails. So see that like that, and it's swirling, but I put it back on and it swirls. So right now you can see I've had so much water that the wand is not touching the water here. So I'm going to take this structured water, pour it in here until it goes up to my wand now, to where the wand is, so that it'll be in contact and structure more of the water, because I'm drinking out of it all the time. How much do I drink? Half my weight in pounds as ounces every day. Maybe a little more, very rarely less. So a swirl of the Mayu is vortex water. The eddies in the water and springs, the moving water gets organized. That's why it's healthier water. But it doesn't hold the structure. As soon as I stop this, that swirl is going to go away. The structure is going to start to fall apart and be less easily absorbed on my membranes. my hydrophilic membranes throughout my body. What is so great about the wand is the structured water in here will last for hours, even after I take the wand out. So I could pour that into another canister and take it with me to drink. So that's that difference. I use my Berkey filter just to clean out Tustin water, elements. I don't think it gets much of the fluoride out. You would have to spend more money on a filter. I think Berkey does make it, but it's more expensive. But in general, I just filter my water from the city in my Berkey filter. Then I put it into my Mayu jar here, okay? And then from there, it goes into my glass. And then it goes into me. Izumia water. Izumia water it's in these little packets. And what they do is they put a chemistry, physical pressure on the water to generate extra hydrogen ions, which are positive, that are contained in the water. And the seal of the packets will not let these hydrogens easily escape. So when you open an Izumia water, you need to drink it all down. That's why it's a 6-ounce little container, because you want all that hydrogen to go into you. Why? Because hydrogens are positive and they help as a neutralizing agent, antioxidant, that kind of a thing. So it costs a lot of money to buy Izumia water. So actually, I'm going to stick with structured water that will have the ability to help me generate my own hydrogen ions. So I think the Zenith is my analemma wand. So go on the internet and put in YouTube and put in analemma water, structured water, and listen to the founders and the researchers and the work of Dr. Potts on farming in the Netherlands and the Dutch area where they had to reclaim the land with dikes and stuff. The research is fantastic. I think it's godly, very, very godly information and science. Jennifer says, I have neck and shoulder pain. I've had MRIs on both. Doctors say nothing is warranting surgery. I'm 49. Would hormone replacement help this? Yes, because hormones are anti-inflammatory. Why? Because they're general contractors. They help you with the elastin, collagen. I put my estrogen on my face every day, not my neck. So you can see more wrinkles here than you can on my face. Yes, they help with reconstruction. I'm so blessed to be in my 70s with no pain anywhere, no restriction of anything anywhere in my body or my back or my knees. And believe me, when I go and work out, now these past 2 weeks, with me healing up from this flu, this little cold, and not being able to rest because I have to work, I'm really rather proud of myself to be able to do all this and work still full time and get through all this even within 2 weeks without having time off. I did take 1 day. And then on top of that, I had oral surgery. So that was another thing that kind of prolonged it into a 2-week scenario. But I'm going to tell you, I think, I did everything that I would have told anyone else. I fasted for 2 days, especially with the surgery of that bad molar that they had to take out. I feel much better since it's gone. I started spontaneously losing weight. I knew that the infection in that tooth over the past 2-3 years was just gradually inflaming me, and that was causing me to gradually gain weight. What else did I do? So I fasted a couple of days. I drank half my weight in water all the time. So for 2 days, I just took my vitamins and lots of my systemic enzymes. They insisted that I take the antibiotics, so I was trying to be a good patient for a change, and I obeyed my oral surgeon, and I took the antibiotics for the 5 days they wanted. Didn't want to do that, but I took a whole bunch of probiotics with it. And without eating for 2 days, that healed up beautifully. I had no pain. I took the high dose vitamin C drip before because I had the cold. I took the high dose vitamin C drip after, and I'm going to do another one this week. So I've had three. Um, I only eat in like a 3 hour window every day. I did back off on my weightlifting because I could sense that I was healing and had the cold and had the surgery. So I was a little bit nicer on my body than I normally am. And I'm telling you, I think my hormones and all this help with the joints, the repair, the sealing, and the healing of the molar socket, whatever they did there. And yeah, I feel great, just great. So yeah, hormones will help you, uh, Jennifer. They will help you. Get a good functional doctor to help you with that. Diane says each time I effort to lose weight, so every time she tries to lose weight or bring my carbohydrates down in the least, my blood pressure drops to abnormally low levels, 88/40. Last weight, lost weight on her last attempt. I've developed POTS, postural orthostatic syndrome, on top of extremely low blood pressures, and took a year or more to recover from that. I am borderline diabetic with weight increasing. Please advise. You need a good functional doctor, Diane, to work with you, your cardiologist. I'm sure you were on the tilt table. I'm sure you had a cardiologist. You might consider putting on compression socks all the time. You have to do weight training. You have to build yourself up. Usually, POTS, postural orthostatic syndrome, is an autoimmune phenomena. Your autonomic system, the parasympathetic to sympathetic, is discordant. It's not talking to each other. So that when you stand up and you need to have that height of your column of your blood vessels, it's not doing it for you. And then you get dizzy and lightheaded and faint. So, or your heart will stop racing like that. You have to work with a doctor that's going to work with you in therapy, doing weight training 3 times a week, gradually building yourself up, and aerobic training, probably on a stationary bike so that your body gets used to it. Wearing compression socks, looking for autoimmune phenomena with a complete digestive stool, getting your blood type, finding out how your membrane health is. Are you eating enough proteins to repair your tissues, your nerve lining? Remember the myelin sheath? And are you drinking enough water? Where your sugar levels are? Many things, plus your hormones as well, and stress hormones. So you need a good functional doctor with your cardiologist, internist, looking at autoimmune and building yourself up, because I do believe we are fearfully and wonderfully made and we can heal. Zolia says, what are your thoughts on wearable vagus nerve stimulation devices for pre-ventricular contractions? Thank you. Well, the older we get, the more often we get pre-ventricular contractions. We're aging, our tissues, our nerve conductions. PVCs are not going to kill you. It is a succession of sinus tachycardia and many pre-ventricular contractions that are linked that put you into a risky rhythm. So work with your cardiologist. And will the vagus nerve work? If you just bear down like you're having a bowel movement and hold your breath tight, that will stress your vagal nerve, which will slow your heartbeat down. And so every lifter has to be careful that they don't make themselves faint, because they bear down so hard, their heart rate slows down in that stress of their weightlifting from what they call the Valsalva vagal maneuver. So do you need to pay money for an instrument for this? You might have a very unique situation, talk with your cardiologist, but why not just bear down like a bowel movement, hold your breath against a tight tummy and close your nose and mouth and see if that will stop it. But most PVCs are benign, innocuous, never a problem. Jennifer says, what can I do to get my low creatinine into the normal range? Usually, I'm telling my patients to drink enough water. So the stupid labs are population averages samples. Most people don't drink enough water, so their creatinine will be higher because their blood is more hemoconcentrated. So when my healthy patients get their labs, they're always slightly low. So normally I don't care about your creatinine if it's like only 0.5 or 0.4, or even 0.3. I tell my patients all the time to eat plenty of protein for getting their creatinine and drink plenty of water. And they're usually, many times, their labs are different than the ranges because my patients are healthy. Tara says, hi, Dr. Rita. My question is, if you are exposed to cold, like minus 14 degrees, well, that's cold, and your hair is damp, what is a protocol you would suggest for a minor frostbite? I used a blow dryer to warm my scalp, not recommended, I read online, after my scalp felt like acid. Is there anything that might be recommended to heal the tissues, stop the burning, and prevent the hair loss? Well, the burning is because when your skin freezes, it crystallizes and it's no longer soft and pliable. So when it becomes hard like that, and if you put a hot surface on it, it doesn't have the fluidity for the blood flow. And so you create two injuries at once and you break the cell membranes. So I would just say, you have to get warm. And how would you get warm? At a moderate rate, you could get into lukewarm water. You could drink warm water. You could start running in place, and make your blood flow that way. But you don't go in hot or air dryer or hot water, because the crystallized cell membranes from a frostbite is injured cell membranes. You have to be very careful how you warm them up. All right, so we're 7 o'clock. We've gone over, and if you haven't already, can you explain apolipoprotein B and lipoprotein fractionated NMR? I'm going to say, forget it. I have practiced 44 years without those silly nitpicking numbers. What you need to do is eat a lower carbohydrate diet, do weight training, exercise 3 times a week, drink enough water, don't eat late, and you want to get your high density lipoprotein to be equal to your triglyceride from your starch and carbs. So you want to be triglycerides around 50, 75, HDL 50, 75 equal. Then I don't care what your lipoprotein little a is. I just don't care, because 44 years, I've never had my patients have heart attacks, strokes, any of these problems when they lower their carbohydrates, they exercise, and they live long, wonderful, vibrant lives. All this nitpicking over micromanagement, the whole picture, that's what you really need to do. Yes, apolipoprotein B is on the carrier molecule protein that carries all of the cholesterol, triglycerides, and fats. And the number of the apolipoprotein B in that will be higher as you dump off your triglycerides, cholesterols, and fats to the various places it's needed in your body. But it's not going to be the determinant. If you're not controlling your carbs and doing weight training, exercise, and if you're eating late, then I don't care what drug you take. You're living a poor lifestyle. Expect poor outcomes if you're not weightlifting, doing aerobics, drinking your water, getting a good night's sleep, and on and on. All right. God bless. Take care, and like and subscribe. And I'm going to try and get a hold of Steve Gregg and see if we can't do a once a week live Ask the Doctor Anything. But we're going to be talking about, I'm going to try and get it organized such that we talk about depression, anxiety, and from a medical and a Christian worldview, how we would look at this, if that interests you. And hopefully I'll get a hold of him in the next 1 week. All right. So God bless. See you next week at 6 o'clock to 7. Tuesday, and we'll go from there. Have a nice Valentine's Day. Love someone. Show them that you care. Forgive, forgive, forgive. Love, love, love. All right, take care. God bless. Good night.